When you've had a hip replacement surgery, it's quite traumatic to the hip. They're taking the hip joint apart, they're putting new bone in, these muscles get moved around. And so, after you have had that initial recovery from your hip replacement surgery, where the incisions are all healed and you can start to be mobile again, it's a really great time to start introducing using the hip hook. That iliacus and psoas muscle that are protecting your hip joint are very likely tight after you've had a hip replacement surgery, and using the hip hook to help put gentle pressure on that area, especially starting in standing, is a really great way to help facilitate your healing. I have seen many times clinically working with clients where they, are working on recovery from their hip replacement surgery, but they're still having a lot of pain in their groin. And that, when you go to the doctor, they would typically attribute that to the surgery or to the joint, when in fact it actually is the iliacus and psoas muscle tension that is producing that symptom. So making sure that that muscle is relaxed is great. Just to reiterate, it's important to wait until that tissue has healed. So typically that can be up to about 3 weeks, sometimes 4 weeks, but you want your incision to be completely healed, and you want to be able to walk around without having significant amount of pain before you start initiating the hip hook. But it is a huge asset to your recovery.